Welcome. Thank you for coming to our education event this evening on oral health and hygiene. We're grateful to have Dr. Brown, Bridget, and some dental students from the University of Illinois Chicago presenting for us tonight. I'll do some brief introductions and then turn it over to the experts. I always joke that in medical school we get about 3 seconds of dental. It's those white things in the mouth. Refer them to the dentist. Dr. Blase Brown has practiced dentistry for over 35 years. He earned a Master's of Science degree in oral biology and a Doctor of Dental Surgery degree from Loyola. And we decided he probably helped assist pulling one of my wisdom teeth when I was a medical student there. He serves as the director of a small group facilitation and a clinical assistant professor in the Department of Oral Medicine and Diagnostic Sciences at the University of Illinois at Chicago College of Dentistry. 5 of his fourth-year dental students are here as well. Melissa Villagane, Laurel, Vana, Camila, Peralta-Sugano, Revis, and Gayatri, Satam. They are part of a student interest group that works with Dr. Rada to provide dental care to patients with intellectual and developmental disabilities in a variety of settings in the community. They'll be graduating in May with a Doctor of Dental Medicine from the University of Illinois College of Dentistry. Bridget Brown. Where to begin? Bridget's an advocate, accomplished speaker, actor, daycare assistant, and volunteer, a dental health educator at the UIC Pediatric Dental Clinic, where she teaches young patients how to care for their teeth. She also founded an organization called Butterflies for Change with her mom, Nancy. They offer keynote speeches, workshops, and one-on-one counseling to assist families, schools, and communities to mobilize with inclusion for people with disabilities. And if that wasn't enough, Bridget recently met the Pope as part of a Vatican-sponsored conference. We're excited to have such a wonderful group of presenters with us this evening. Let's give them a warm welcome.
Thank you, Dr. Chacon. We're actually going to start with Bridget, because Bridget's going to kind of tell us about kind of the ABCs of taking care of your teeth. So you ready, Bridget? Okay.
Can I ask everyone a question?
Sure.
How many people here think it is important to take care of your health? Well, having a healthy mouth is very important, part of having a healthy body. It is more than just looking good, but that is important too, how we feel of ourselves. Having strong teeth and healthy gums helps us to eat, chew, swallow, speak, and many more. Our mouth is connected to the rest of our body. So keeping your mouth healthy keeps our bodies healthy. All of us deserve to have equal quality of life, free from pain and infection. A good place to start is with the basics of taking care of your teeth and gums. We all need to have a good place to go where people can take good care of your mouth. We call that a dental home. It is important to have a regular dental checkups and get your teeth cleaned at least twice a year. Some of us need to go more often, 3 or 4 times a year. Sometimes people come there for 6 months for cleanings. When we use the term oral hygiene, it is all about removing plaque from our teeth and gums. That is called attacking the plaque. Plaque is the sticky film that forms on our teeth, which is full of bacteria. We brush and floss our teeth and use products like toothpaste and rinses to help get rid of plaque every day. Oral hygiene also is about eating the right kinds of foods and snacks and trying to prevent problems in our mouth and in our body. It is very important to clean your teeth regularly every day. Some of us can't do this well ourselves. Some of us just need to be reminded when and how. Some people need their parent, caregiver, or guardian to help. I like to set up my dental hygiene supplies before starting. This way I always follow the same pattern and will not forget to do something. I usually use a power toothbrush when my charger broke. So my dad just got me a new one. Here I have a brush, prescription fluoride, dental floss, a rubber tip stimulator for my gums, and my paste, and Listerine mouth rinse. It does help if your dad is a dentist. Let's take a look at this YouTube video about brushing your teeth.
Do my hair. I'll give it a try. Shut everything down before. Oh. It did. Let me go back. Okay. We'll go on, Bridget. We'll see if we can do it later. Okay.
Do you want me to show them?
We're going to do demonstrations at the end of our presentation, so for everyone.
A good goal should be to brush your teeth with fluoride toothpaste 3 times each day. The first thing we do before brushing our teeth is to wash our hands. If someone is helping you, they need to wash their hands. Also, it is the best time for brushing, usually at the start of the day in the morning and before you go to bed. So make sure you set aside a period before going to bed for the routine of brushing and flossing. To do a good job, you should brush for 2 minutes. For using a regular manual toothbrush, one of these 2-minute timers works well. Power toothbrushes are great, and a timer is usually built into them. Remember to be very gentle, just like a butterfly. If you are using soft manual toothbrush, always use a feather touch. Do not scrub hard. Apply a pea-sized amount of toothpaste only once. Power brushes are easy to use and easy to hold. Just let the brush do the work. You do need to learn how to properly use one of these. They come with directions, or you can also watch a YouTube video. If that does not work, you can also bring it to your dentist's office. So you can have the dental hygienist to help you. Or they can also show you how to use it. They are really easy to hold, have a timer, and help you to be gentle. Or B now has one of them connects with an app on your phone that tells you when, how long, and how hard you have brushed. This is my new toothbrush that my dad just got for me. important for all people, especially those of us with Down syndrome, to clean plaque from in between our teeth and under the gums. Study shows that if we can have a very good hygiene, it will help us to avoid losing teeth because of gum disease, which many adults with Down syndrome have trouble with. Flossing does take some skill. Not everybody is able to floss, even people who do not have a disability. So don't give up. For those of us who cannot use floss, there are some other devices that can help. Some of us may need a caregiver to help. Whether you are doing the flossing or getting better is the best start with a piece of about 20 inches long. Wrap it around your index fingers like me in this picture. You then use your thumb and your index finger to hold the shorter piece and gently slide it in between your two teeth. You want to make sure you be careful with doing that. I always wrap it around each tooth like a C shape, like this picture right here. Sometimes I go backward C, and then I go forward C. Sometimes you want to make sure you have to do a very good hug along that tooth. Not too hard. I always try to wrap it around each tooth. You move it from up and down, not back and forth. This should be done gently since plaque is soft and loose. And sometimes our gums are tender. Now I would like to give this back to my dad.
Thanks, Bridget. We do like everyone to clean in between their teeth at least once a day to remove plaque. And some of the alternatives, if you can't use floss, if it's just too hard, there are a number of alternatives. One is a Proxibrush, which I have a picture of here. You can buy these at any drugstore, and they come with little teeny brushes that look like old-fashioned bottle cleaners. And they slide nicely in between your teeth, particularly if you have any kind of recession or spaces in between your teeth. And then one of the companies that makes this product also makes these smaller ones now. These are the gum brand, Butler, and I have some samples of them here, and it's like a miniature Proxibrush with a little cap on it. You can stick it in your pocket or your purse and take it anywhere during the day with you. A nice alternative to using dental floss. Some people will use these little floss holders. You do have to thread floss around them, and you can't get it quite as tight as you can when you're holding it with your fingers, but having a handle to use the floss sometimes makes it a little bit easier, and for some people it's the only way they can actually use a piece of floss. Gum company, Butler, Sunstar, also makes this little device, which I can't necessarily recommend it, but it is an aid that some people have found useful. You may have seen things like this in the drugstore. Some people like these also as alternatives to regular dental floss. They're kind of small to hold, and they're meant to be used once, and they're disposable. But probably, oh, and this is my newest toy. So this is something that the company that makes the Sonicare toothbrush just came out with not too long ago, and it's called Air Floss. So I know it sounds kind of gimmicky, The unit costs about $90. I didn't check on at Walmart to see if it was less expensive, but it uses a puff of air. You put it in between your teeth, and you push the button on the top, and it just puffs air. So the company has some studies. Of course, they finance the studies, so there's a little bias there. But there is some effectiveness that is close to using some of these other aids. So it's nice and lightweight. So anyone that would have trouble holding something that was small would have an easier time holding on to this. Or if you're helping someone to clean their teeth, it's very easy to use. It also comes with a little reservoir, so you could put something like Listerine or some other kind of mouthwash in it that might help remove plaque. That is the air flosser. These, also made by the same company, Sunstar Butler, are these soft picks. And I have some samples of them here. These are most hygienists, dental hygienists love these now. So they're very small, they're very gentle, there's no metal, they're all rubberized. They're very easy to use. Maybe the hardest thing about these is just the size. But a wonderful alternative to using dental floss if you cannot use dental floss. And they're meant to be disposable, so you can use one or two to try and clean your mouth. One of the advantages of using dental floss, and Bridget was talking about having a 20-inch strip, is that every place in the mouth you use it, you can move the floss and always have a clean piece. With most of these aids, you're using the same device to clean in between all of your teeth, and that isn't always the most effective way to do it, but as an alternative, these devices are very useful. You can also remove plaque using rinses. So over the counter, there's two rinses that really have some evidence that they actually do something. They're actually worth using. One of them is Crest Pro Health, and the other is Listerine. Listerine is just made up of a variety of oils. I have always recommended Listerine Zero because it has no alcohol in it. If you look at regular Listerine, it has about 22-23% alcohol. Alcohol will dry your mouth, and if you happen to be a person who's having trouble with dryness in your mouth, it's something that you wouldn't want to use. But Listerine Zero is alcohol-free, and it is effective at helping to remove plaque. Then there are also prescription-level rinses. This is one called chlorhexidine. Brand name is called Paradex. It's a really broad-spectrum antibacterial rinse. It's very effective. It's a prescription rinse, and it's used in short-term use with most people that have a prescription for it. However, you can use it in the long term, and I've had a number of patients with disabilities using this product on a daily basis, and what they would do is they would dip their toothbrush into it as they would brush their teeth. Or if they were using a Proxibrush, like I showed you before, they would dip the Proxibrush in and then clean in between their teeth. So not only would they be cleaning in between their teeth, but they'd be delivering a few drops of this very effective antibacterial rinse. Or I had other patients that would just take a swab, like a large Q-tip, and when they finished cleaning their teeth, they would swab their teeth also with this prescription Paradex. Fluoride is wonderful. Over-the-counter fluorides are in toothpastes and rinses. And what fluoride does essentially is it strengthens the enamel of teeth and helps teeth resist decay. Fluoride also has an antibacterial effect, so it does have some effect on plaque in the mouth. And any toothpaste you use should be one that has fluoride and has been recommended by the American Dental Association. And then this is ACT. It's an over-the-counter fluoride rinse. So these products, like the rinses, are usually recommended by your dentist depending upon the risk that you might have for getting cavities, for decay. In the dental office, for a very, very long time, we used to apply gels and foams and inside trays with fluoride, which many people found very difficult to hold in their mouth for a minute or 2 minutes, or used to be even longer than that. But currently we use a varnish, and the varnish is very easy to have placed on your teeth. It's painted on, just like this picture, with a little brush. As a matter of fact, it's something that could be done here in the Down syndrome clinic by a nurse. It can be applied by almost anyone. You don't have to have a perfectly dry mouth. It's a very effective product, particularly for someone that needs additional fluoride. And then there is prescription level fluoride. So this is something that has to be prescribed by a doctor, a dentist, and it's for people that have really a high rate of decay or a high risk for decay, and you worry about the progression of decay. Bridget uses this right now. Bridget's been free from decay for most of her life until last year. And so her dad, being a dentist, is really kind of concerned about things, so he prescribed prescription level fluoride for her. And that takes us to dental decay. If you've ever heard me speak at any other settings about children or adults with Down syndrome, there's a lot of studies and information that go back many, many years that show that younger individuals with Down syndrome have lower rates of decay. And if you compare them to the general population, they do much better than the rest of us. A larger number of individuals that are completely free from decay. But that doesn't mean that individuals with Down syndrome will not get to decay, and it doesn't mean that they don't have the risk for getting decay. As a matter of fact, if you look at Down syndrome and many of the aspects of what that means for an individual, there are risks that other people do not have because of having Down syndrome. But where it becomes even more an issue is with aging. And so if you get into adulthood with having Down syndrome, your risk can change for getting decay. So you can have a greater risk for getting decay just by being an adult. And it has to do with just other things that happen with aging. Things like dry mouth, maybe changes in the diet, developing problems with your gums, small or large problems with your gums, any changes in your cognitive ability. And then also as an adult, here in the great state of Illinois, access to care in a dental office would also be included in that. So there are changing risk factors as those of us with Down syndrome have that will make you more susceptible to getting cavities as time goes on. So I'm just going to show you this one slide. This was a patient of mine who, with Down syndrome, and at age 25 was the first time she developed any kind of decay. And that's when I first started seeing her as a patient. Or I started seeing her at age 28, and she had developed a little bit of periodontal disease, had a little bit of recession of her gums, little loss of bone, and she started getting some cavities on her root surfaces. Now, these are in places you get cavities and you never thought you could get a cavity. And the reason she was getting them was because of some of the changes that took place in her mouth with the gum disease. So her risk for getting cavities changed, and it just happened to be in her mid-20s when this took place. And really what that means is many of us still need to be reminded to take care of our teeth. Those of us that don't have Down syndrome need to be reminded to take care of our teeth. We do that with our patients all the time. So having conversations at home and reminding ourselves about taking care of our teeth with good hygiene, and for those that need supervision, making sure they get good supervision, and maybe even some of the life changes that take place with parents and guardians and living arrangements with adults with Down syndrome, making sure that there's proper supervision for oral health when those changes take place. I think that's something that is often overlooked. Diet, nutrition. Good nutrition is something important for general health. I guess that's kind of obvious, but I couldn't skip it here. And it's something that all of us probably should be constantly discussing, not only with ourselves and our families, but with our healthcare providers. And those of you with Down syndrome need to make healthy food choices. That includes proper food portions. It also means avoiding excessive amounts of high-fat and high-sugar foods. So if I had played the video, it would have shown you a part where eating fruits and vegetables, primarily raw vegetables and fruits on a daily basis, because of the fiber content of those, have a natural way of cleaning teeth and actually take plaque off of teeth. And so they're nice to include in your diet, not only just for the healthy aspects of eating fruits and vegetables, but because they actually do something physically to your teeth that helps keep your mouth healthy. And then avoid sugary snacks. I'm a dentist. Avoid sugary snacks. And probably the worst sugary snack is the one you like the most, and it's a bottle of pop. And it's so easy to get addicted to bottles of pop.
Oh, God.
So, and I'm a great believer that you can't tell someone to stop doing something without giving them an alternative. So if someone really does one thing, you have to find something good to take its place. But soda really is, there really is nothing good about it. We all like to do it occasionally. But soda that is sweetened with sugar causes cavities very easily. And if you're drinking a lot of it, it has very bad effects on your teeth. It also is acidic, whether it's sweetened with sugar or it's diet pop. And we're going to talk about that in a few minutes, about the effect of acid from things like soda pop long-term on your teeth. And then there's gum disease. So gum disease really is the major oral health problem that adults with Down syndrome have. And just to let you know, gum disease we usually think of it as this disease that's caused by bacteria in our mouth, where there's inflammation, so that means our body's trying to fight the bacteria, and the combination of the bacteria and our body trying to fight the bacteria causes a breakdown in everything that holds our teeth in, including the bone, and so eventually the teeth start to loosen up. And if it goes on long enough, your teeth will lose all of their support and will fall out. Individuals with Down syndrome, because of some of the weaknesses in their immune system, develop a different type of gum disease that is really caused by the changes in their immune system. So it is a major problem. So what are some signs? Well, sometimes bad breath is a sign, but not always. If you start getting funny tastes in your mouth, if your gums get swollen or are bleeding, don't look nice and pink anymore, or all of a sudden your teeth start feeling loose, these are all signs that you could have gum disease. Yeah, I wasn't going to show that, but I thought why not. So here's just a very simple illustration of a healthy tooth. Healthy gums, nice roots, bone holding the tooth in. Here is an illustration of gum disease, periodontal disease is what we call it. And you can see that here's bone that's starting to erode away here and here. And it's the bone that actually holds the roots and holds the teeth in your mouth. And so periodontal disease is a very serious thing, because once you start losing all of that support for your teeth, you can't get it back. even if you stop the gum disease, it doesn't return. So it is a very serious issue. And the question is, because of the immune system issues in individuals with Down syndrome, is can you prevent periodontal disease, or can you prevent tooth loss? And it's a question many of us have constantly asked. And there are some pretty good studies that have been done that show, and these are in populations of adults with Down syndrome, that good periodic oral health care with a dentist, with a dental hygienist, and good hygiene at home on a daily basis, which means brushing and flossing your teeth, can improve or stabilize long-term oral health and can actually prevent tooth loss because of periodontal disease. So in a sense, these studies show that progression of periodontal disease, even where it had begun, was slowed or stopped and maintained. There are individual levels of susceptibility in adults with Down syndrome, and there's no really way to predict who's more susceptible than one person or another. But based on these studies and in our preventive approaches, individuals, adults with Down syndrome who follow a good preventive regimen do have success in maintaining their teeth. So I had a population in my practice. I stopped practicing 3 years ago, and I had 34 or 35 adults with Down syndrome that were my patients. And in the last decade of practice with them, no one lost a tooth to gum disease. So there were some trauma and fractures. So we know that there's some success in following preventive strategies and having a connection, a good dental home where someone cares about you and can make sure that you get the proper kind of care that you need. So I'm going to turn this over to what Dr. Chacon didn't say is these are our 5 finest students in the 4th year at UIC. The finest.
Well, I thought that one was without saying.
Yeah.
Okay, perfect.
Okay.
Hi everybody, I'm Camila. So today I'll be talking about dry mouth and the common problems with that. So dry mouth can occur with certain diseases, or sometimes it's really common with a side effect through medications. And the significant effects it can have on your health is it can affect swallowing, right? Imagine having nose kind of lubricant in our mouths to help us swallow. Also holding our food in our mouths properly, being able to chew. It can also lead to tooth decay because our saliva is kind of like a natural rinse in our mouths, and it's able to kind of move and have the bacterial flow and our food flow as well. So without that, it can increase the risk of tooth decay, just like what Dr. Brown mentioned, also gum disease, without having that saliva present. Oral infections, basically bacteria can thrive, they can grow in your mouth with just having dry mouth. And then also with that, you have an increase in the plaque and bacteria. So some ways to, does it go by itself? Oh, sorry. No, it's okay. Oh, there it is. So some ways to solve dry mouth is to continue your daily brushing and flossing. Okay, so proper oral hygiene. You can also use your fluoride toothpaste, which we mentioned before, and we showed some samples of those. Some ways too, if you have dry mouth and you want to kind of stimulate your saliva, it's good to chew gum or mints. A big key thing is it has to be sugar-free, right? Dr. Brown was just saying we want to decrease our sugar intake and limit that. You can also sip water frequently throughout the day, so have some water. There are also some substitutes that are over the counter that you can buy. There's ones called mouth, these are specific names of mouth coat, is that pronounced like mouth coat? Oasis moisturizing, aqua oral, it's a prescription, and then there's also an oil balance type. And then you can use mouthwashes for dry mouth. A common one is Biotine, there's Act Total Care for dry mouth, and this kind of acts as a saliva substitute that you can use throughout the day. to help you with that problem you may have. And then also at night, it's very common to get a mouth breather, and you can have a nighttime humidifier to help keep the environment kind of moist for you. All right. So some things that we kind of touched up on is to how we can help the situation with dry mouth, is to avoid sugary foods and acidic foods with drinks. Avoid caffeine. Caffeine is actually a huge factor of dry mouth. Occasionally, anybody who's a big coffee drinker, tea drinker, like I am. Anything containing alcohol as well, mouthwashes. So anything like the Listerine Zero, like Dr. Rada mentioned, is a great way to prevent dry mouth. And anything over the counter too. Antihistamines or decongestants. So avoid those. These are, so we touched up some ways to help increase or prevent dry mouth or help solve it is using the sugar-free gum and mints. You can see here, these are photos of examples of those. So ACT has a nice kind of like a cough drop, dry mouth that you can use throughout the day and can help you with that. We have this is a photo of, is it the Square products? No, that's the three of them. Yeah, xylitol. Mints as well, examples like the mouth or rinse and the ACT. These are kind of nice. The only thing is you kind of have to use these throughout the day, depending how severe your dry mouth is. But that's a great substitute over the counter. There is Biotin 2 moisturizing gel, or even the toothpaste they have out that can help with dry mouth. Here on the bottom right, all these on the bottom are over-the-counter kind of sprays or just sprays and saliva substitutes you can use throughout the day just to spray instead of using a mouthwash. You have to rinse your mouth and then spit it out after. And then the nice thing too with the mouth coat too is actually those are all natural ingredients and have something called xylitol, and studies have shown that xylitol can decrease the risk of tooth decay. So that's a kind of a nice thing added to that. And then here, this is a new over the prescription, right? Prescription saliva or artificial saliva spray that is out, and I have not heard much from it, but it could be a nice solution to dry mouth. And then I will pass it off to Gayatri.
So how could someone get dry mouth as an adult with Down syndrome? Well, really heavy mouth breathing really has an effect of drying saliva, drying the tissues out, and so the effect of saliva is less. But then if you start taking medications, there are certain medications that just have an effect on saliva flow. And all of us as we age seem to need certain medications. And so that becomes sometimes a primary reason for some of our family members that have Down syndrome as they become adults, depending on what medications they're taking, is it will have a direct effect on saliva. And without saliva, all these other problems will exist.
Okay, so I'm just going to go through some systemic issues that can arise from dental problems that we kind of touched upon earlier. So having gum disease and dry mouth and improperly brushing our teeth can increase the amount of plaque and food and bugs that we accumulate in our mouth. And so when we breathe those in or aspirate them, they can go straight to our lungs. And when they go to your lungs, you have a higher risk of getting upper respiratory infections like pneumonia. So it's really important to decrease the amount of bacteria in our mouth. And there's, like we said, there's a bunch of different ways that we can go about that. But that can also prevent other issues from arising in the rest of our body. And then choking is also an important consideration, especially as you lose teeth and you lose the ability to chew. And if you have dry mouth, you can have trouble swallowing. And if you have low muscle tone, so you're not able to swallow as efficiently, that can also cause choking. So it's really important that we, if we know that that's a problem for us, that we cut foods up small. We kind of change the foods that we eat, so we're not eating anything that can cause choking. And then also mouth breathing can affect choking as well. So that's another important consideration.
And since all adults, all people with Down syndrome have lower muscle tone, and many are mouth breathers, that it does make choking then a risk for people with Down syndrome.
And bacterial endocarditis. So that is when there can be an infection of one of the layers around your heart. So if you do have a predisposition to that, it's important that sometimes you have to take a medication, an antibiotic, before you go to your dental treatments, especially when you're getting a cleaning done or a deep cleaning done, because that causes the bacteria in your mouth to get into your bloodstream and that can go straight to your heart. So we want to make sure to take preventative measures when that is a concern.
And some of our family members who had congenital heart problems required surgery. Not all of the heart problems, but some of them have residual defects around valves that remain, and they're susceptible to getting this infection called endocarditis. And one thought, and there is a little bit of evidence to support this, is as the health of your mouth improves, the risk for getting that goes down. So if there's a lot of inflammation and a lot of bacteria in your mouth, and you happen to be an individual with Down syndrome that is susceptible to endocarditis, then your oral health has a direct effect on that, and making your oral health as optimal as possible would be very important.
I'm sure everyone at some point in their lives had bad breath, and you may wonder what you could be doing to help improve the scent of your mouth and your breath. But the most simple and straightforward answer is better oral hygiene, better brushing, better flossing, better taking care of your gums is going to decrease the risk of having bad breath. So bad breath comes from the bacteria in our mouth that are living their lives, doing their normal bacteria processes, spitting out bugs, spitting out dirt, and it stinks, right? So if you're brushing and flossing, like you're saying, 2 to 3 times a day, every day, you're going to be more likely to get rid of all those bacteria and all those extra compounds that come with bacteria. And that's going to decrease the chance of having bad breath. Another thing people don't think about is areas of our mouth besides our teeth that need to be brushed as well. So the tongue is a very common area. If you're noticing that you might be having bad breath issues, brushing the tongue and then brushing the palate, which is the top of the mouth. Those are 2 spots that people tend to forget to brush. They just brush the teeth. But that being said, mouth breathing, which we've talked about so far, is another concern when it comes to bad breath, because if your mouth is very dry, those bacteria are going to be more likely to kind of stick around and stick together in that environment. So something to look out for is always making sure you're drinking lots of water throughout the day, doing plenty of rinses, brushing as frequently as you can, and making sure that if you do find that you do have these dry mouth symptoms, or if a dentist has talked to you about dry mouth, that you are taking appropriate steps to treating it, like Camila was talking about. Maybe that means getting a biotine rinse or getting a prescription to help with the dry mouth throughout the day. And sometimes it's as simple as carrying water throughout the entire day. Bad breath can also be an indicator of gum disease, as Dr. Brown was saying. It's one of the signs, but not always a sign, so that's something to look out for too. If you notice in conjunction with red, bleeding gums, if there's also a bad breath smell, that's a pretty good sign that you might have periodontal gum disease, and it might be time to get a deep cleaning. People always ask if mouthwashes and whatnot can help with bad breath, and more often than not, a lot of mouthwashes don't actually help, especially if they have alcohol in them and they're drying out the mouth even more. You're just perpetuating the problem. I believe in a minute I'm going to show a picture, of Closes, which is a mouthwash that has been shown to neutralize some of the sulfur components that are involved in bacteria and made by bacteria, and that is one potential option for helping with the bad breath in the form of a rinse. Bad breath can also be a sign of something more systemic beyond the mouth. Sinus issues, upper respiratory infections, digestive issues, those can all lead to bad breath as well. So if you're finding that the mouth is clean, there's not a lot of plaque, there may be other places to look for what the cause is. So don't just assume that it's going to stick around permanently. It might be something that can be addressed by your primary care doctor.
Okay, bruxism. So what is bruxism? It's a fancy way of saying that some people grind or gnash their teeth together. So this is a common problem that people have in adults with Down syndrome, but it's also a common problem for a lot of adults in general. And some people don't even know they grind their teeth. A lot of people grind their teeth at night. Some people grind their teeth when they're stressed. And why is it important that we kind of look at this and understand it? Is because when people grind their teeth, they can wear them down, and it can cause severe wear of your teeth. And when your teeth start to wear, like in this top figure, it wears away the enamel, which is the hardest layer on the top of your teeth that protects your teeth and the nerve. And when it wears away, what can happen is when the dentin gets exposed, the next layer of the tooth can start getting more sensitive. It can be more susceptible to getting cavities because it's not as hard, so the bacteria can penetrate it a little bit better. The other things that you have to worry about is you could get headaches from grinding your teeth. Some people wake up and when they wake up in the morning, their jaw really hurts, or by their ears it hurts. It's from grinding. So a lot of times there's no way to really stop grinding, but there's some things that you can do to kind of prevent the wear of your teeth. There's a mouth guard that some people can wear at night. There's all different kinds of them. There's a smaller thermoplastic mouth guard, which is much thinner now that it's made, but I guess the best way to look and think about a mouth guard is to visit your dentist, because what they sell in the store, while it can work for a little short time, it's probably better to get one that fits exactly for you. And it can be very effective to wear a mouth guard. And it can prevent the wear, but even if you started grinding and you have some wear, it can prevent further wear. So this is very good for people who grind. The other thing is that sometimes people can't wear a mouth guard because they have a sensitive gag reflex, so that's why it's really important to visit your dentist and talk to them about it, because sometimes they can modify it so you can wear it when you have a sensitive gag reflex.
Hey guys, I'm Melissa, and I'm going to talk a little bit about tooth erosion. So this happens when the protective outer layer of your tooth enamel begins to wear away, like Laurel mentioned. So who likes Oreos here? Everybody does, right? So what happens when you get rid of the outer hard cookie part? The inside part, the soft part, remains, right? So that's kind of like your tooth. You have your outer enamel portion, and then on the inside, you have your more sensitive dentin layer. So what happens is that you erode your outer part by exposure to acid, and when the enamel thins out, your protection, or your crunchy coating, is weakened, and it can expose you more to acid and bacteria.
I like that.
So this puts you at greater risk for having problems like Laura mentioned, like decay, cavities, and infection on the inside, more delicate part. So here are some sources of potential acid exposure. So as you guys can see, all of our favorite sugary snacks and acidic sodas and things like that, dry mouth, like we touched upon. If we have problems with reflux or with GERD and other eating disorders, so sometimes your food kind of creeps back up on us after we finish eating, right? So here we look at the chart of the acidity of many of the common drinks that we like to have, and other sodas and other types of liquids. So the higher the number, the less the acid. So we want to say it's better to use or drink the liquids in the blue areas, like water and sugar, milk, flavored milk. We want to stay away from the things that can be more harmful to our teeth, like soda, beer and wine, orange, apple juice, sugary drinks, even Diet Coke.
epilepsy are pretty close to stomach acid and not that far away from the battery car acid.
So how do we help kind of with the possible damage that can occur from erosion? So like we mentioned, we all talked about oral hygiene is very, very important. We definitely want to focus on supervision to remain constant with our oral hygiene at home and making sure we're visiting the dentist. Toothbrushing, we want to wait 30 to 60 minutes following exposure to acid. We don't want to do it right away. Rinsing immediate with water. If you're out at a family party and you have some soda, you can't stay away from it, rinse with water right away. And then using things that will remineralize and help with our enamel layer, like things like the fluoride toothpaste we talked about, prescription fluoride, and MI paste.
So one thing that was on there was gastroesophageal GERD, reflux. And actually Dr. Chicoine might be able to say something about this, but in individuals with Down syndrome, adults with Down syndrome, there's actually a high occurrence of obstructive sleep apnea. And there's a connection between sleep apnea, obstructive sleep apnea, and gastroesophageal reflux. So an adult with Down syndrome who might not have been diagnosed with obstructive sleep apnea could actually be contributing to erosion of their teeth from the GERD that's related to sleep apnea. I don't know if you...
So that's true, and GERD is in general more common in people with Down syndrome, and so there's lots of things we can do that, you take a medicine, but there's lots of things we can do that don't require taking the medicine. Not eating too much food at one time, not eating right before bed, limiting acidic foods, limiting things like coffee and tea and Coke. Again, we go back to that. All those things make reflux worse. So all the things that have been talked about already also, many of those things also contribute to reducing the reflux as well.
Yeah, and trying to reduce reflux without medicine is probably preferable.
Correct.
And most of the medicines that are prescribed for GERD have a direct effect on salivary flow in the mouth. And so you start treating the GERD, but then you, as with all medicines, you have something else to deal with. And in this case, you will dry up saliva and then have oral health issues as a result of treating the GERD with common medicines that are used right now. So, our last topic is kind of a sore spot for my profession, or maybe our society in general, and that is the fact that there's a lacking of what I call a dental home for all people with disabilities, which includes adults with Down syndrome. Many of you may have been seeing a pediatric dentist when you've been younger, and we age out of, we grow up. And pediatric dentists, they treat a lot of people with disabilities, but they treat young people. And they actually don't have the knowledge and skills that a general dentist has in terms of trying to treat the kinds of oral health issues that you see with adults and that you would see with adults with Down syndrome. So even the American Academy of Pediatric Dentistry, which is a nationwide organization of pediatric dentists, has written a position paper talking about the transitioning of disabled adults from pediatric offices to general dental offices. Problem is where do you go? It's a constant problem. So these fine students work with Dr. Bob Rada, who's in the range, who about 70% of his practice involves treating people with developmental disabilities. He does IV sedations in his office with a nurse anesthetist. Bob's a very busy guy doing that. When I was practicing, I had a good size number of patients with a developmental disability. I know Dr. Chicoine would occasionally send someone my way or call and ask a question. But they're in the educational system here in Illinois and in many other states, there aren't a lot of good structures in the curriculum in the schools and clinical experiences for students in terms of treating people with disabilities. Here in Illinois, it's
We're the worst state.
yes, thank you, Bridget. We are the worst state. So,
In many cases.
and it's really a healthcare financing problem. So it's a societal problem. There's a number of us that have been advocating in various places to try and change this. And so where do you go? So if you don't have a place to go right now, I have a list of general practice residency programs here that are affiliated with hospitals, but there's only 3 of them in the Chicago area. There's a handful of dentists who, like Dr. Rada, who see patients with developmental disabilities on a regular basis. But the truth is that every general dentist probably has the skills to treat most individuals with Down syndrome. And then some are going to need a higher level of care, which might mean sedation. But with everything we know about individuals with Down syndrome, we really would like to avoid doing sedations or putting someone to sleep because there's risk, and particularly as you age with Down syndrome, there's more risk in doing that. So, finding a dentist, and sometimes, and you can, well, these are 5 individuals who we think are going to remain in the Chicago area, who we're going to give their name to Dr. Chicoine, because they're going to be people in their practices and their careers who will be taking care of people with disabilities, which is why they're here and sharing their time with us today. So I don't have any really good answers. What I usually tell parents to do is to talk to your congressmen, talk to your politicians.
Your legislators.
But going back to general dentists, a dentist who's willing to learn a little bit and is patient may be able to take care of your family member or you with a little bit of modification. But I don't have any answers, and I'm almost apologetic about it here in Illinois. So
I have a question. I noticed you're showing a different flosses. You didn't show a water pick.
no, I didn't. I think I had it on there. So water pick is a good alternative too.
Okay.
Yeah, it's a good alternative. Matter of fact, they have a handheld water pick now that it doesn't have like the long tube. It's kind of heavy and it's a little messier. But yeah, water pick would be a good alternative also.
I saw that Bridget uses the MI paste. What is that?
So MI paste is it's
Right there.
It's there. It's calcium and phosphate in a milk protein, and it remineralizes teeth. So it returns calcium. You need calcium and phosphate to do that, and it's a prescription product.
It actually says on here, it says entire cavity, rebuilds enamel, and helps to get sensitivity. Just kind of like sodium fluoride helps that too.
So what she does with it, it's a prescription product, but pharmacies don't have it. I know that sounds kind of typical, right? And your dentist can get it. Okay, so your dentist can get it. And
It helps.
Bridget
It helps
uses
with
it.
renewal.
Yeah, so she has a little bit of erosion. So she has a little bit of erosion, so that's why I have her using it. And she just puts it on her finger and spreads it.
So it's not toothpaste, it's like an after brushing
Yes,
treatment
yeah. Or you can put it on right before bedtime.
to repair like the enamel
Yeah.
and help with sensitivity.
Yes.
So,
sorry, even though there might not be any erosion yet, it would still be good to use it?
Well, I mean, if there was a risk, for erosion,
So, it'd be best to ask the dentist, like when I take her for her checkup.
or Dr. Jamai, too. I mean, because he'd be able to help you with that. So, and I think about, things like sleep apnea and reflux, and what Dr. Chacoin said about individuals with Down syndrome having more reflux, and it has to do somewhat with the low muscle tone and the muscle between your esophagus and your stomach. So knowing this and being a dentist, I wanted Bridget using this because rather than me waiting until I see those little craters, oh yeah, there's reflux. She has high risk for having reflux. So I have
So the doctor can prescribe it as well as the dentist?
Mm-hmm.
So I can go for
They're not going to find it though in the pharmacy?
No, it's not. It's not marketed in the pharmacy because it has a smaller. Yeah. It's a dental supply company, a manufacturer that actually makes it and then markets it. But it is prescription level. You can get it. I've seen it on some online pharmacies. Incredibly expensive there because it's not a very expensive product. So I would buy cases of it in my office, and then if I had a patient that I was going to recommend it to, then essentially I had to be the pharmacy. And that's how that works.
And it also gives you correction inside of it.
How about those toothpaste that say they have enamel or Colgate with enamel or enamel is claimed to think it's most, is that of any benefit? I can't remember the name of that building.
Pro-enamel, yeah.
Yes.
Pro-enamel. It's an excellent toothpaste.
It is,
Yes.
okay.
Yeah.
It says there's a commercial on it on TV about it. It's some of the dentists that have the commercials, they talk about it.
Okay.
So,
Well, he's been using it faithfully so because he did have erosion. Yes, yes.
There's so many toothpaste, it's really hard. You just like
I know.
toothpaste, isn't it?
I know it's going to like looking for a wine.
Yeah, there's a lot of serious marketing that goes on behind
Yes.
the toothpaste. And you notice when you watch those TV commercials or see the magazine ads, they put a nice big stripe of toothpaste on toothbrushing. You should only put a little tiny bit. They want you to use as much as you can.
Yes, that's interesting. Now, what toothpaste do you think are the best?
Well, it's as far as over-the-counter toothpaste, it really depends on the patient. So like in my own office, I would have samples of 3 different kinds of toothpaste. Because I had some patients who just scrubbed too hard. And so I would try to find toothpaste that had less abrasives in it. Because most toothpaste has silica, like sand in it, and it's an abrasive. And if you brush hard with it and you put too much toothpaste on, you'll wear away your teeth, which is why we only want you putting a pea size. So if I wanted someone with low abrasive toothpaste, I would recommend that. But usually it was something like Pro-enamel, a basic toothpaste that had fluoride in it. There's a lot of marketing about whitening, and it's mostly marketing. Anyone else have a question? You do. What is your question?
Mama told me is about web medicine.
Oh, Will Robson. He takes that when he gets, because I noticed what you said about decongestants.
Yes.
And stuff, and actually he has glaucoma too, so I don't give him decongestants. But red medicine, he's talking about Will which you drink, and that helps break up mucus, and so I don't know if that helps with this dry mouth, who knows. But he just takes that with he has seasonal allergies, so it's not really related to the tooth care.
If it's Mucinex, it should not dry out.
Yeah, you know what, it's just, Over-the-counter Walgreens, it's just Velocin brand, like, it's not as expensive as
Then I would not expect that to drive you away.
yeah, I wouldn't either. I would think it might even slightly help a little bit, because it's supposed to break down, make things flow better. Yeah, right.
Thank you, Mom.
No, you're welcome.
I know you mentioned it several times, but can you just mention it one more time? That even when you're an adult, it might be helpful if once in a while somebody else was in there helping you with your
Yes.
teeth and checking them regularly. Doctor.
Yes. I even check on this person who's like a professional toothbrusher.
I'm in there all the time, making sure that she's brushing her teeth. I just want to make sure that she does it,
There's a new adult resistance in our house.
Yeah.
The interesting thing that I over the years that that's happened though with all of my adult patients that have Down syndrome is oftentimes we might have to do the opposite. The supervision would be you're doing it too hard, or you're using too much toothpaste, or you don't need to brush your teeth 6 times a day.
I wish that was a problem.
I think it's interesting too that the disease and the problems are showing up in adulthood as opposed to in childhood.
Yes.
I was not aware of that, and that's interesting.
Well, and there's all these, there's a bunch of different factors for
Right.
that.
No, I just,
yeah.
it's great education because I wasn't aware that was a new problem that could start.
I have a question for the students. Can I introduce Katie? Is she still
She
here?
had to head out.
Oh, Katie had to head out. Katie is our occupational therapist. She does a lot of work with sensory issues. And we've been using a lot of that in reducing anxiety, non-medicinal ways to reduce anxiety. And one of the things we've been looking at using that for is things like when we walk across the parking lot to get blood drawn, but then what also maybe the implications for dental care as well, so that we would not have to sedate, because we do get a lot of requests for sedation. So if it's possible, perhaps, as we're working on some of these things, we could use you guys as a resource for some of the issues with the dentistry, and we very much appreciate it. So if it's possible, maybe we should get email addresses. That would be most appreciated. Because I'm a Dr. Rada, I would really like to see us not have to use sedation. So let's put it this way. I think there's probably some of our patients that get sedated that we could get by without sedating. If we tried some of them.
I think one of the biggest things too, you guys can put in that we've learned is that really it's all about patience. Like we have, we will, even if an appointment is 5 minutes or even 2 minutes, it's a step forward. And it's all just about introducing the new environment, the tools, we have the sounds. And so it's not like, it doesn't have to be rushed. And I think that's a lot of what is the problem sometimes, I think, too. It's not a thing that we don't have the skills for it. It's just really the patience and the time and the consistent appointments and things like that. So sensory issues is a big thing, and I know that we have worked with that and found ways to go around it, but.
And some, I think, setting up appropriate expectation.
Right.
You're not going to run in and get your wisdom to build out with local anesthetic on the first appointment, probably not.
I think sometimes we also at least in my experience, if a patient had a really difficult time, you can talk to their parent or someone who comes with them and give them maybe some of the tools. So maybe that would work with an occupational therapist, like a mirror and some of the things that we use, and then the patient gets used to it in a non-threatening environment, like at their home or where they feel comfortable. And then when they come in, they're a lot more comfortable with us taking a look